Are you wondering how liothyronine, also known as Cytomel, works as a thyroid hormone medication and whether it's right for you? In this video, we'll break down everything you need to know about Cytomel, from its uses and benefits to side effects, dosing, and pharmacist tips, all backed by science. What is liothyronine? Cytomel. Liothyronine, commonly known by the brand name Cytomel, is a thyroid hormone medication prescribed to treat certain thyroid-related health conditions. It is a synthetic form of triiodothyronine, T3, one of the essential hormones naturally produced by the thyroid gland. This medication plays a key role in regulating metabolism, energy levels, and overall hormonal balance. Liothyronine, Cytomel, is often taken once daily by mouth and can be prescribed for people of different age groups, depending on their medical needs. While weight loss may occur as a side effect of liothyronine, Cytomel should never be used solely for weight reduction. It is a targeted thyroid hormone medication intended for managing specific thyroid conditions under the guidance of a healthcare professional. What is liothyronine? Cytomel. Used for. Liothyronine, also known by the brand name Cytomel, is a thyroid hormone medication prescribed for several thyroid-related conditions. It is most commonly used for hypothyroidism, low thyroid hormone levels. Liothyronine helps restore normal hormone balance when the thyroid gland does not produce enough T3. Thyroid cancer. In some cases, Cytomel is used alongside radiation and surgery as part of a comprehensive treatment plan. Thyroid suppression test. Liothyronine may be given to help healthcare providers diagnose certain thyroid disorders. How liothyronine Cytomel works. Liothyronine is a synthetic version of triiodothyronine, T3, one of the two main hormones normally produced by the thyroid gland. Thyroid hormones are critical for regulating metabolism, maintaining body temperature, supporting heart rate, and ensuring proper energy balance. When the body does not produce enough thyroid hormone, patients may experience symptoms such as fatigue, weight gain, and sensitivity to cold. Taking liothyronine, Cytomel, as a thyroid replacement therapy helps restore normal hormone levels, improving energy and supporting healthy metabolic function. What are the side effects of liothyronine? Cytomel? Like all thyroid hormone medications, liothyronine can cause side effects if hormone levels become too high. Many of these side effects improve as the body adjusts to the medication. However, it is important to report persistent or worsening symptoms to a healthcare provider. Common side effects. These are typically signs of excess thyroid hormone in the body: shakiness, fast or irregular heartbeat, fever or sweating, heat intolerance, feeling hot easily, hair loss, increased appetite, diarrhea, weight loss, muscle weakness, fatigue, nervousness or anxiety, irritability, difficulty sleeping, shortness of breath. Serious side effects. Although less common, serious side effects require immediate medical attention. Heart problems such as chest pain, shortness of breath, weakness, cold sweats, or pain radiating to the jaw, neck, back, shoulders, or arms, which may signal a heart attack or other cardiac complications. Liothyronine, Cytomel dosage forms and costs. Liothyronine, sold under the brand name Cytomel, is available in tablet form and prescribed as a thyroid hormone medication to restore or adjust thyroid function. The cost can vary depending on the dosage strength and pharmacy. With discounts such as GoodRx, prices may be significantly lower than retail. Available tablet strengths and prices, approximate for 90 tablets. 5 micrograms, $23.07, about 26 cents per tablet. 25 micrograms, $39.99, about 44 cents per tablet. 50 micrograms, $49.64, about 55 cents per tablet. Typical dosing for liothyronine, Cytomel. The prescribed dose of liothyronine varies based on the individual's health condition, thyroid hormone levels, and treatment goals. Always follow the dosing instructions provided by your healthcare provider. Hypothyroidism. A typical maintenance dose ranges from 25 micrograms to 75 micrograms by mouth once daily. Thyroid cancer. The dosage is individualized and depends on the target TSH, thyroid-stimulating hormone level set by your physician. Thyroid suppression test. Standard dosing is 75 micrograms to 100 micrograms once daily for 7 days. Liothyronine, Cytomel contraindications. Certain medical conditions make the use of liothyronine unsafe. These are known as contraindications. Inform your healthcare provider if you have any of the following, as liothyronine, Cytomel may not be suitable for you. Untreated adrenal insufficiency, a condition where the adrenal glands do not produce enough hormones. Pharmacist tips for taking liothyronine, Cytomel. Liothyronine, also known as Cytomel, is a thyroid hormone medication that requires careful and consistent use to ensure effectiveness and safety. Here are key pharmacist-recommended tips to help you take liothyronine correctly. Take it at the same time each day. Consistency is important because it keeps thyroid hormone levels steady. Choose a time that is easy to remember so it becomes part of your daily routine and helps reduce the chance of missed doses. Follow up with regular blood tests. Your prescriber will monitor your thyroid hormone levels through routine blood tests. These tests ensure that your liothyronine, Cytomel dose is both effective and safe. Never skip recommended testing, as it guides proper dose adjustments. Watch for signs of overmedication. Most side effects of liothyronine are related to having too much thyroid hormone in the body, which can mimic hyperthyroidism. If you notice shakiness, a racing heartbeat, nervousness, or unexplained sweating, contact your healthcare provider. Your dose may need to be adjusted. Review your full medication list with your healthcare team. Liothyronine, Cytomel, can interact with other medications and supplements, which may change how they work. Notable interactions include blood thinners, insulin, and cholestyramine, Prevolite. Always let your prescriber and pharmacist know about all medications and supplements you are taking to prevent complications and ensure safe treatment. Liothyronine, also known as Cytomel, is a powerful thyroid hormone medication that plays an important role in restoring balance for people with thyroid disorders. When used correctly and under medical supervision, it can help regulate metabolism, energy, and overall health. However, it's important to follow your prescriber's instructions closely, keep up with regular blood tests, and report any side effects or concerns. If you found this video helpful, make sure to like, share, and subscribe to HeInfo, your all-in-one destination for trusted, science-backed health information. Turn on notifications so you never miss important updates about thyroid health, medications like liothyronine, Cytomel, and other essential topics for your well-being. And remember, always talk to your healthcare provider before making any changes to your thyroid medication.